Hello everybody, good afternoon. My name is Deb Mastrolia. I am a nurse here at Hoag Hospital, and my specialty is neurosciences and stroke. You can see on the camera there that there's a bunch of alphabet soup after my name, and I always like to tell people about that. What it means is that I'm not just making this stuff up. I've been a nurse for 40 years, and I'm certified in critical care. I'm certified in neuroscience nursing, and I'm also certified in stroke nursing. So you can be assured that this is all evidence-based medicine that we're going to be talking about. So by the end of this, my goal is that you are all going to be stroke smart. There essentially are 3 R's to stroke. All right, reduce, recognize, and respond. So let's get started and talk about how to reduce your stroke risk. But before we do that, what are we talking about? What is a stroke? A stroke is brain injury. It's caused when there is a blood vessel to the brain that becomes blocked or bursts. So I always like to tell people it's all about the pipes that are bringing blood and oxygen to your brain cells. It either gets clogged or it starts leaking. When it's clogged, when there's a blockage, it's called an ischemic stroke. And that's most of the time, 87% of the time it's ischemic stroke. When the pipe is leaking and it's bleeding, that's about 13% of the time, and it's a hemorrhagic stroke. And there are different types of hemorrhagic strokes, and we'll talk about that later. So, every 40 seconds in the United States, somebody is having a stroke. So how many strokes are going to happen in the next half hour that we spend together? I always say too many. About 800,000 strokes occur in the United States every year, yet 80% of them are preventable. So what we want to do is learn the risk factors and prevent you all from having a stroke. Certain risk factors you can't do anything about: heredity, age, race, and we're going to talk about that. But most of them you can. And so I want you to feel confident that you're going to know how to change, treat, or control any of your risk factors. So what's out of our control? Age. Unfortunately, we get older day by day, and every 10 years after age 45, your stroke risk nearly doubles. And even though it seems like stroke is grandma and grandpa's disease, it really isn't. We see younger and younger people having strokes all the time. Children can have strokes. And I can tell you that right now in my stroke unit over there and the hospital on the hill, you could have a 30-year-old, a 40-year-old, a 50-year-old, a 60-year-old, and then our older patients, 70, 80, 90, and even 100. I think our oldest stroke patient was 107. If you have a family history, that increases your risk of having a stroke. So again, this is immediate family: parent, grandparent, sister, brother. You want to be aware of that and then take control of your risk factors. Race also makes a difference. Statistics show that African Americans have a much higher risk of death from a stroke, and Hispanic and Latinos also have unique risks for stroke. Gender also affects your risk, and unfortunately, women have more strokes than men, and stroke kills more women than men. And I always like to throw in this, it's not really a fun fact, but this fact. Did you know that twice as many women die from stroke than die from breast cancer? And when you think about it, everybody knows when Breast Cancer Awareness Month is. Everybody knows what the pink ribbon represents, and everybody knows that they should get their mammogram every year. But how many people know when Stroke Awareness Month is? And how many people really know the facts and figures and the risks and the signs of stroke? Not too many. When they do surveys, about 50% of Americans really know what a stroke is. So please know your risk factors. I'm glad you're all here with us today. Prior stroke, TIA, or heart attack also raises your risk of having a stroke. A person who's had a stroke has a much higher risk than someone who's never had one. We need to take a minute and talk about TIAs, or sometimes people call them mini strokes. So I'm sitting here in this room full of young people, and all of a sudden my face starts to droop, my speech gets all slurred, and my arm's not working, all right? They all go, oh my gosh, what is happening? I'm glad I'm here at this presentation because now they're gonna know. They think, oh, Deb is having a stroke. And they call 911, and by the time 911 gets here, I'm completely back to normal. That's a TIA. That's a transient ischemic attack. For a short amount of time, maybe there was a little blood clot up in that artery, but then my body was able to break down that clot on its own. Blood and oxygen got back to those brain cells, and I did not have a stroke. I had a TIA. And when brain imaging is done, say an MRI, it will show no stroke and no damaged blood cells, or not blood cells, brain cells. All right, so those were all the risk factors that you can't really control. But let's talk about the things that you can. The number one cause of stroke is high blood pressure. Can you control high blood pressure? Yes, you can manage your high blood pressure. All right, and we're going to talk about different things that you can do to manage that blood pressure. Normal blood pressure is considered 120/80. And the American Heart Association in November of 2017 put out new blood pressure guidelines. So you can see on the screen here that 120/80 is considered normal. When the top number, the systolic number, starts going up and gets as high as 129, that's considered elevated blood pressure. Okay, you're gonna start walking more every day, you're gonna watch the salt in your diet, you're gonna reduce your stress. Then blood pressure, when it's between 130 to 139 or 80 to 89 for the lower number, the diastolic, that's when it's considered stage 1 of high blood pressure. And when you're meeting with your doctor, again, he's going to talk about the different things that you can do without medication. But then if it should start to climb to 140/90 or higher, that's when you need to start looking at possibly some medications to control the blood pressure. Diabetes. Having diabetes more than doubles one's risk of a stroke. Many people with diabetes also have high blood pressure, high cholesterol, and are overweight, and then this just helps to increase the risk of stroke even more. So managing your blood sugars when you're diabetic, managing that hemoglobin A1C and trying to keep it at 7 or lower is really important. Every 2 minutes, an adult with diabetes in the United States is hospitalized for stroke. So work with your doctor and try to manage your diabetes. How do you manage diabetes and blood pressure? By watching your cholesterol and watching your diet. So high cholesterol increases the risks of blocking the arteries. And if an artery leading to the brain becomes blocked, a stroke can occur. So how can we control cholesterol? Hopefully with diet and exercise, sometimes with medications. Sometimes you need to go on a statin in order to control that high blood pressure, high cholesterol. And statins have gotten a bad rap over the years, but I can tell you that most of our patients in our stroke program go home on Lipitor or another statin and have no side effects at all. So if you do, of course, you're going to work with your doctor and find out what medication would work best on bringing down those cholesterol levels. Diet. Okay, eat foods that improve your heart and brain health. So everything that you do for heart health improves your brain health, right? So eating foods that are vitamin-rich fruits, vegetables, the Mediterranean diet. People often ask me, okay, what's the best diet that I could follow for brain health? Well, the Mediterranean diet takes a look at fresh fruits and veggies, fish, low-fat meats, and olive oil for your fat. So you don't want to have high saturated fats, trans fats, as they all raise your blood cholesterol levels. And of course, salt. We want to watch the salt intake. And I love those two pictures, right? Everything that you do for your heart health, veggies and fruit, helps your brain. physical activity. The weather is beautiful out there today, and it's getting warmer and sunnier, so let's all get outside and get active, right? When you're at home and sitting around, and I know we've all been isolated with COVID, but grab your mask and get out there and take a walk. Physical inactivity increases your risk of stroke, increases your risk of heart disease, becoming overweight, developing high blood pressure, high blood cholesterol, and diabetes. You can see how they're all connected, right? So daily physical activity will increase your quality of life. You get in a good mood when you get out there and see the sunshine and smell the fresh air. So take a walk. Take the stairs if you can, and do whatever you can do to make your life more active. The recommendation is that you get at least 30 minutes of activity in on most days. Now, some people, especially some of my stroke survivors, they can't tolerate 30 minutes of activity all at once. So what if you do 10 minutes in the morning and 10 minutes in the afternoon and then another 10 minutes towards the end of the day? That still equals 30 minutes, and it will help you. It will help you to feel better, and it will help your heart, and it will help your brain. Maintain a healthy weight. Watching your diet, physical activity will all help you maintain a healthy weight. If you're overweight, take steps to try and get your body mass index down and into a healthy range. So what is body mass index? Well, it's a calculation. You can Google it and put in your numbers and come up with exactly where you are. If you look to the left of that screen, are you in the normal range up to 24.9? Are you overweight up to 29.9? Obese goes up to 39.9, and then greater than 40 is really considered morbidly obese. So you want to work on getting a healthy weight, not a crash diet, and getting that BMI down. Tobacco. Don't use tobacco, okay? No smoking, no vaping, no smokeless chewing tobacco. Recent studies confirm that cigarette smoking is another crucial risk factor for stroke. And what's the science behind it? Well, the nicotine and the carbon monoxide in cigarette smoking damages the blood vessels, and that really makes it easier for you to go ahead and have a stroke. Atrial fibrillation. All right, atrial fibrillation. The heart is a pump. And there are two chambers on the top of the heart, and there are two chambers on the bottom of the heart. All right, the bottom of the heart are the ventricles. And when those ventricles pump, if they fibrillate, just kind of shake, well, that's a code blue. That's no pulse, and that's do CPR. But when the top two chambers fibrillate or don't have an organized rhythmic pump, that is called atrial fibrillation, okay? And when the heart is not beating in that organized pump, there's a chance that the blood will pool in that chamber. And then if you do get a good effective pump, that when it's pooling, it's going to form a clot, and then that clot will travel up to the brain. When that clot travels up through the artery to the brain, it blocks that artery, and that is when a stroke can occur. So atrial fibrillation, you might feel it as a rapid heartbeat. You might feel it as palpitations in your chest. And if you feel any of these things clinically, you need to talk with your doctor about it. And on EKG, if you looked at it, you can see there's a little shot of an EKG there on the screen. It's a very irregular heartbeat. If you have stroke risks associated with that atrial fibrillation, then the doctor will look at prescribing anticoagulants. And you hear about these anticoagulants for non-valvular atrial fib all the time on TV, right? For some Xarelto, Pradaxa, Eliquis, and Coumadin. We still use warfarin or Coumadin for atrial fibrillation also. So if you have known atrial fib, it really is important that you're following up with your physician, you're getting your anticoagulation meds if needed, and keeping your heart healthy. carotid artery disease is another risk factor for stroke. All right, the carotid arteries come up here in the front of your neck, and they supply blood to your brain. When there's a narrowing, and you can see a picture of that plaque buildup, so a patient who's had high cholesterol levels over a period of time gets atherosclerotic plaque building up on the artery wall, and then let's say they become dehydrated, and the plaque gets inflamed. It could block off blood flow up to that whole side of the brain, okay? So carotid artery disease should be monitored for, and if you have it, there's a point where you could become symptomatic with that carotid artery stenosis, and then you follow up with physician. It might lead to carotid stenting, carotid endarterectomy. But again, you can see how these two arteries, these two roads, pathways up to supplying the brain with oxygen are really important to keep open and clear. So carotid artery disease should be followed up with a physician. Stay hydrated, all right? This seems pretty simple, okay? So dehydration has been linked with inflammation, with artery stiffness, with blood pressure regulation and other factors, and these can all cause heart disease and stroke. Drinking water throughout the day is one of the most effective things you can do to improve health and well-being. So I'm a real visual learner, right? So if you're dehydrated, imagine that the blood is more viscous, is thicker, and the platelets are going to get stickier and easier to stick together and form a clot, which could cause a stroke. So staying hydrated with water is really helpful and really simple. The thing is, if you wait to get thirsty, your tank is already empty, all right? So you have to keep that volume up. And as we get older, we lose our sense of thirst. So waiting until you're thirsty to drink more water is really not an effective solution. Trying to drink 8 glasses of water a day is a good general rule of thumb. Again, if you have heart failure, if you have kidney failure, you're going to want to talk with your doctor about what is acceptable levels of water to be drinking. But really try, and especially for my stroke survivors, I tell them, fill up a water pitcher. And if you like it cold, put it in the fridge. If not, keep it out on the counter. And by the end of the day, that water pitcher should be empty. Because you need the visual to make sure that you're drinking all of that water. And if you don't like the taste of water, try slicing some green apples, some lemons, some lime, cucumber, mint. Put something in to naturally flavor the water, and that might help you find it more palatable. Staying hydrated. Don't stay hydrated with alcohol. Okay, if you drink alcohol, do so in moderation. Alcohol tends to dehydrate you, along with caffeine. I didn't touch on the fact that if you are drinking a lot of coffee or tea or colas and they're caffeinated, that caffeine also dehydrates you. So that doesn't get to count into the amount of water that you're drinking each day. But getting back to alcohol, the U.S. Dietary Guidelines, 2015 to 2020, the new ones haven't come out yet, say that people should limit their alcohol-related risks by drinking in moderation, which means 1 serving of alcohol per day for women and up to 2 servings per day for men. And when we did these presentations in a live audience, somebody would always raise their hand and say, well, how big is 1 drink? So you can see the visual aid there. 1 drink is considered 1 beer, 12 ounces, or I think it's 5 ounces of wine, or 1 shot glass full, I think that's 1.5 ounces of liquor. So again, if you drink alcohol, do so in moderation. Sleep, restorative sleep. We need to get enough sleep. Good sleep, benefits your whole body, including your heart and brain, with good effects such as improved mood, memory, and reasoning. Our brains need time to shut down. We need time to let it all go and get a good rest. All right. Drinking alcohol and too much alcohol might put you to sleep quickly, but then you usually wake up, and that doesn't really help with restorative sleep. Some sleep medications can, but we have a great sleep center here at Hoag, and if you're having problems with insomnia, I really encourage you to see a sleep medicine doctor. Also, if you should notice sleep apnea, and usually it's the sleep partner that notices that someone has sleep apnea, and that is that snoring, 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 and then all of a sudden there's a long period with no noise, and then a big snore, snore, snore again. This could be obstructive sleep apnea, and it really increases your risk of having a stroke for that time period, and sometimes it's up to 45 seconds where someone is not breathing. The oxygen